Thousands of people struggle with knee and hip pain every single day. But how many truly understand what joint replacement really means?
Hi, I'm Dr. Eric Lipkowski. I'm one of the orthopedic surgeons here at Total Orthopedics. I specialize in hip and knee replacement surgery. I am also the chief of the division of arthroplasty for St. Joseph's Hospital. And today I'm going to be answering your biggest questions about hip and knee replacements in the simplest way possible.
So how do you know if you need joint replacement surgery?
So the patients who get joint replacement surgery are people who have osteoarthritis or rheumatoid arthritis, basically any type of damage to the cartilage and bone of the hip or knee joint that's failing treatment with conservative measures. A joint replacement surgery is something that's permanent. It's an implant that lives with you for the rest of your life. It's a relatively speaking big surgery, so we don't jump into it. You start with conservative treatments, meaning anti-inflammatory medications like ibuprofen, Motrin, things like that, as well as physical therapy. When that's not working, we go on to injections such as steroid injections or gel injections, or even sometimes people get PRP injections. When that's not working, that's when we say, okay, it's time to discuss the surgical treatment, the permanent treatment, which would be the joint replacement surgery.
Dr. Lipkowski, can you tell us about the surgical approach that you use for hip and knee replacements these days?
For hip replacements, I use what's called an anterior approach. That's going through the front. Uh, Typically, the traditional approach for hip replacements was what's called a posterior approach, where they would go through the back. Though for the layman, what you might have seen is more a scar on the side of one's thigh going up towards the buttock region. The reason that I do an anterior approach is that it is a faster recovery. It's an earlier recovery. It's a muscle sparing approach, whereas the posterior approach was one where you'd have to go through a big muscle, the gluteus maximus muscle. The other reason to prioritize basically an anterior approach for hip replacement surgery is that you are less likely to see dislocations. You are more likely to have your leg lengths be where you plan them on being, which is something that's a little harder to judge from a posterior approach.
And doctor, do you use robotic knee replacement? And if so, can you tell us a little bit about it?
I do use robotic knee replacement. As far as what the robot actually is, I would love to say that it's a machine I could flip on and take a nap in the corner and it would just do all the work for me. That's not quite what it does. Traditional knee replacements is where we use manual cutting guides to place the implants. And the way we would do that is we kind of line up with our eyesight and these little metal probes and say, oh, it looks about straight. And while that did work very well for many years, the robot is technology. It allows me to very precisely place the cuts, place the implants to fractions of millimeters and degrees exactly where I want them to be.
And can you tell us, doctor, what actually happens during hip replacement surgery?
So what hip replacement surgery is, it's replacing the ball and socket of the hip joint and changing it out for metal and plastic with a ceramic head in between. For a hip replacement joint actually looks like is this. This is the femur bone, the thigh bone. This is the pelvis with the acetabulum, which is the cup part of the hip joint. The ball part, you can see here, is no longer bone. It's replaced. If I take this model apart to show you, this is what the femur side actually looks like. If I take the stem out, this is the stem that goes into the bone, with that pink being the ceramic ball. That's the new ball of the ball and socket joint. As far as the cup goes, this is what the cup itself actually looks like. This is the back side. And then you can see on this side, it's got the liner, which is that plastic in between. That becomes the new cartilage effectively for your hip joint.
So doctor, what happens during knee replacement surgery?
So during knee replacement surgery, similarly to the hip replacement surgery, we're taking away the diseased bone and diseased cartilage and replacing it with metal and plastic. For what it actually looks like, when people say they're getting a knee replacement, what they think is, if you look at this model, they think I'm chopping up here, chopping down here, all this bone goes away. Really, it's more of a resurfacing procedure. If you look, the actual implant itself is only about 8 millimeters. This is the real size of a femur implant that goes onto the bone itself. And on the other side, tibia side, again, it's fairly thin with a little keel that goes inside the bone to hold it in place, as well as that plastic liner in between that plastic becoming that new cartilage. That's what a knee replacement actually looks like.
Dr. Lipkowski, how long does it take to start walking again after hip replacement surgery?
So after hip replacement surgery, you are walking Basically immediately. Same day, you're up and mobilizing. That's what we want you to do, is be up and walking, because that is your new permanent joint. It's what you're going to be living with. We want you to start using it right away. Most patients get spinal anesthesia for their surgery, meaning they're kind of numb from the waist down. You're put to sleep during the procedure, so you're not awake during it, but there's no breathing tube, so it's a very safe way to do the surgery. Once that numbing medicine wears off, typically an hour, 2 hours, then that's when you're up and moving.
And how long does it take to start walking again after knee replacement surgery?
After knee replacement surgery, it's the same thing as after hip replacement surgery. It's numb from the waist down from the spinal anesthesia. Once that's worn off, you're again up and moving. We're using a cane or walker in the beginning for mostly balance and safety purposes, of course. But again, that's your new permanent joint. That's yours. We want you to start using it.
Does joint replacement surgery hurt, and how is pain managed after surgery?
So as far as joint replacement surgery goes, and pain after surgery, there's the hip replacement part and the knee replacement part. Because the hip joint is so deep inside of your body and how painful hip arthritis can be, those are patients where sometimes after surgery, they're actually feeling better than they did before they went into surgery. There's always going to be some degree of surgical pain with hip replacement surgery, but not nearly as much as one might think. Knee replacement surgery, I typically warn people to expect a certain degree of pain afterwards, because it's much closer to the skin. It's much closer to that bending surface. And because of that, we have engaged in what we call multimodal pain control, meaning we don't just rely on a single type of pain medication. While narcotics are used, they're fairly limited thanks to the use of all of these other techniques, including anti-inflammatory medications, Tylenol, as well as specific blocks given both by the anesthesiologist and by myself at time of surgery.
What does life look like after joint replacement surgery?
After joint replacement surgery, what I tell people is once you've hit 6 weeks, you can live your life however you want. All restrictions are removed at that point. What I warn people, I don't give anyone restriction to get them what I call caveats. The plastic liner becomes your new cartilage. Similar to the cartilage you have when you have arthritis, the more you use it, the more you abuse it, the shorter it's going to last. That being said, modern day plastics, right now we say they last on the scale of 25, 30 years. That's because they've only been out for 25 or 30 years. In 5 years, I'll probably be saying they last 35 years. In 10 years, I'll probably say they last 40 years. We just don't have the data to technically prove it, but they're not catastrophically failing left and right.
Doctor, why is physical therapy important after joint replacement surgery?
Physical therapy after joint replacement surgery is very important, mostly for two things. One is your gait, and two is your range of motion. Because of the deformity that happens with arthritis, your leg lengths are short, your leg is bowed or knock-kneed. You have been walking wrong for many, many years. And I correct that in the span of about an hour. So we need to get you back to walking normally. The other thing that's very important is the range of motion. Scar tissue sets in on a scale of about 3 months to be permanent. And what I tell people is that whatever range of motion you have at 3 months is, relatively speaking, roughly your permanent range of motion. So we have a little bit of a clock to get your motion to where we want it to be. People who've had arthritis have limited range of motion for many years. So again, it's just you getting in to do the work to get back to where you used to be before you had that disease.
So, doctor, what type of music do you listen to in the operating room?
So I listen to reggaeton, actually. A lot of Bad Bunny gets played in my operating room. And the reason is because I did my subspecialty training in the University of Miami, and that was basically all that we listened to. So it has stuck with me, and I brought it back up here to Long Island.
Doctor, what's one thing that you tell your patients not to do that you do yourself?
Probably the worst thing that I do that I tell people not to do is stair climbing. Stair climbing is the highest degree of force you can put through your weight-bearing joints. And my favorite exercise is the Stairmaster, which is not great for my knees, but I enjoy doing it too much.
So, doctor, when you replace a joint, do you say something cool like upgrade complete or activate cyborg mode?
I don't say anything like that, but I do tell people that they are a little bit kind of the $6 million man or woman once they're done.
What's the weirdest thing someone's asked to keep after joint replacement surgery?
No one's asked me to keep anything, but I have had a few people ask to be awake during the surgery, which I don't know why you would ever want to do that, but that was their request.
If you weren't a surgeon, what would you be?
If I wasn't a surgeon, I'd probably be a carpenter because, to be perfectly honest, I am basically a glorified carpenter who knows a few extra medicines.
Is there such a thing as being too young for joint replacement surgery?
This is a question I get asked all the time, and age truly is just a number. What really is important is how severe the disease is, how severely limited the person is, and if they are not being controlled by those conservative means. If someone who is 40 has severe bone and bone arthritis and has failed physical therapy, anti-inflammatory medications, and injections, it would be cruel to tell that person they need to wait 20 years to get a knee replacement, because I want them to go back and live their lives and do what they want to do. On the flip side, there's really no such thing as being too old for a joint replacement surgery. It's about how healthy you are. If someone is 95 but is as healthy as an ox and they're going to live another 20 years, there's really no reason not to consider that person for surgical intervention as well.
Are there any real patient questions that keep you up at night?
There's no specific question that patients ask that keep me up at night, because every patient experience is an individualized, personalized experience. Everyone has different questions, different concerns, different things that I need to treat. So there is no one glaring question that everyone has that keeps me up thinking. So if you have any more questions about total joint replacement surgery or arthritis of the hip and knee, please follow us for more information.